Great. Thank you all for having me. As was mentioned, I'm Kyle Leggett. I'm a practicing family physician in Lone Tree and Aurora. And I'm going to tell you guys briefly about a patient of mine who's really stuck with me, Sarah, who I met during my second year of residency. And it was at the beginning of a clinic day when I scanned my schedule and I saw a new patient, a hospital follow-up for a 50-year-old woman who had newly diagnosed heart failure and pulmonary hypertension. And the more I read the chart, the more I felt my intestines kind of gather into a knot. She had never seen a doctor until this hospitalization, and now she had all of these newly diagnosed, uncontrolled chronic diseases. And later that morning, I met Sarah, and in walked this morbidly obese woman with a ruddy complexion. Her edematous feet were straining against the straps of her sandal. Her oxygen nasal cannula was askew, and she just had this look of utter defeat already across her face. And as any good junior resident physician does, I started the visit by agenda setting. And we adjusted her diuretic regimen, her heart failure medications, and I developed a plan for treating her depression, chronic pain, and I even rebandaged the blistered skin from her lower extremity edema. And this whirlwind of checklists later, there were still a lot of things we had to address. And I said, let's plan for a 2-week follow-up. And she visibly blanched and said that was impossible. And I come to find out that she lives over an hour away from my clinic and that there was nobody closer who took her insurance. And she can't afford to take the time off of work or pay the $20 copay to come see me in the office twice in the same month. And in that moment, I just went into autopilot. I finished the visit by utilizing my social worker and care manager, trying to minimize those barriers to her care. And she left and I finished the rest of my clinic day without issue. But as I was driving home that night and the adrenaline from a rapid clinic day wore off, I found myself really ruminating on her case. At that point, I was already struggling with burnout and moral injury. And I came to this realization that my 4 years of college, 4 years of medical school, and at that point, 2 years of residency training hadn't actually given me the tools to help Sarah. I felt equipped to deal with her medical diagnoses, but I felt helpless to change the underlying problems that were actually causing her health issues. And that sense of helplessness, more than anything else, really weighed on my shoulders. And there were brief moments when I considered stopping medicine altogether. And just a few short weeks later, I vividly remember speaking to Sarah on the phone, listening to her try to catch her breath between words. Clearly, she was struggling to breathe and likely in a heart failure exacerbation. And I begged her on the phone to come into the office or go to the emergency room. But through distant breaths, she refused, saying that she needed to spend the remaining money that month to pay rent and not come see a doctor. And about a week later, she was hospitalized with a severe heart failure exacerbation, and after which she had to take a medical leave of absence from work, and she lost her home. The ironic thing is Sarah worked for a health insurance company and had their insurance. And it was these instances of trying to suboptimally manage these medically complex patients with phone calls instead of office visits and these preventable hospitalizations that caused me to look for solutions to the underlying problems. And I truly believe that a single payer healthcare system like the one described in this report is that solution. It would mean that patients like Sarah can have equitable access to affordable health insurance that they can actually use. It would mean prevention instead of reactionary care. And it would mean early treatment and management of illnesses before they become crises. And finally, it would mean a reduction in the learned helplessness that drives burnout for thousands of healthcare providers across Colorado. So I urge you all to use this report and use your voices to help transform healthcare in Colorado and ensure we have a better future for our patients and our providers. So thank you all for having me, and I hope this changes things.